That's why I have Dr. Bridge Bombi on of Centric Health. This is the Centric segment here. He's been joining me for many, many months, kind of getting to the details, bringing an expert's eye to help us laymen understand how these viruses work, what is the strategy of the vaccine, why certain areas of the world are worse than others, what constitutes herd immunity, what is best for all of our health, and then of course we speak to the resistance, of which there's a lot. There are still a lot of Americans, a surprisingly large percentage of Americans who are still hesitant to get the vaccine, will they benefit from herd immunity? Perhaps. We'll talk about that. Can we reach herd immunity? Another question for Dr. Bombi. Dr. Bridge Bombi is with us. I want to welcome him back to the Richard Bean Show. How are you, Dr. Bombi?
Richard, I'm well. How are you?
I'm doing terrific. I'm feeling good about things, just like I told you last week. First day without the mask mandate. Are you in total agreement with this no longer mask required?
Richard, it's a landmark decision by CDC. And to me, it's a directionally appropriate step. But the way they presented, it leaves a lot of blanks to be filled. So the guidance says if you're vaccinated, you can intermingle with people both inside and outside with certain caveats. What they left out is, what is a vaccinated person? How do we know a person is vaccinated?
Thank you. That was my question too.
Yeah. So is it an honor system in which a person A, B, or C walks in and this is vaccinated? How do we know that is so? When there is a resistance in a large part of the society in multiple states, that proof of vaccination will not be honored. How do you know? So for CDC to say that vaccinated people can intermingle leaves half the country out. If you look at the numbers, right now we are almost at 50% in terms of first dose, and we are at 35% in terms of both the dosages. So when you have half the country without even a single dose, how do you open up casinos, all the businesses, and say the mask mandates are out? The thing that, Richard, we know that has worked throughout the pandemic is that mitigation measures work. When we maintain distance, when we have the masks, we substantially lower the transmissibility of disease. So if you look back in the places like doctor's offices, my own office, hospitals, we have stayed open through the entirety of the pandemic. And there isn't any evidence there was much of contagiousness that occurred in those places. And the reason for that was mitigation measures. Mm-hmm. So what it does is, with half the country immunized or partially immunized, and maybe much more based on the people who had natural infection, but we don't have clarity to give a blanket endorsement that masks are unnecessary, the mitigation measures are unnecessary, may be premature, but directionally, it's a beautiful thing that we have arrived at a moment that was inconceivable at the beginning of the pandemic. Nobody, for a moment, the bulk of the scientists and the thought process was, we will struggle to find a vaccine like we struggle with the influenza virus. So we've been very fortunate. The robustness of science, the miracle of science is incredible. The efficacy of vaccine is incredible. I think what motivated CDC is two things. One, the vaccine is very effective in eliminating infections. And second, the transmissibility. So the vaccinated not only not get infected, even when they get infected, the viral load may be attenuated to a large degree. So they can't infect others. So that's endorsement of the efficacy or the robustness of the vaccine. My concern is it a little premature? Should we have waited to finish the 12 to 16-year-old vaccinated? We enlarge the pool of immunized people.
Yeah. Doctor, let me ask you this, talking to Dr. Bridgebomby. Dr. Bomby, if I'm vaccinated and I know that the vaccine is extremely effective, that if I contract it, as you say, it'll be a very kind of mild version of it, why do I need to wear a mask at all? If I'm vaccinated, can I still spread it somehow? And if I can spread it, if I get it, isn't it a much weaker version of itself?
Richard, logic lends to that thought process, except we don't have the longitudinal experience to endorse the thought process. So the breakthrough infections occur. You probably know what happened to the Yankees. They had 7 people who, on routine testing, were found to be positive.
Mm-hmm.
Bill Maher, one of the comedians who has the show on HBO, had to cancel because he tested positive. So there are a lot of people who we don't know the breakthrough infection rate because most people will be asymptomatic. Another corollary or extension of that question is, do people who have the vaccination have asymptomatic infections or likely to be long haulers? So there are some questions that haven't been answered. So in this the prudence is best part of the chivalry. There is no need. We have achieved so much. We are near the conclusion of this process. So first, CDC was erring on the side of abundance of caution. Now they may be erring on the side of a little bit of recklessness. I think the degree of immunity that's achieved by a person varies. If a person has immune compromise to begin with, the chemotherapy, vasculitis, immunosuppressant medications, organ transplant, several of those people, even after the double vaccinations, show no evidence of antibodies. So the vaccination in itself may not be panacea for entirety of population. So to give a blanket statement creates a little bit of confusion. So I know the intention is right. I know directionally we are in the right direction, but it's more nuanced than a blanket statement that was issued by CDC.
Right. Dr. Bomby, do you think that we made a mistake in setting up a vaccination system where we basically don't know who has been vaccinated? Perhaps we do, but I know, for example, Centric, you guys vaccinated I don't know how many people. I'm sure that if you were required to, you could call up the records and say, here's the number of people we vaccinated. But there's no central clearinghouse I'm not aware of or is there a central clearinghouse? Can the federal government push a button on their computer and go, here's everybody who's been vaccinated? Or are they just getting with names, or are they just getting reports of numbers from the various organizations like Centric who did it? And if that's the case, shouldn't we know who's vaccinated and who's not? Or because, as you said, right now it's the honor system.
So it's a very good question. The answer to that is who knows, because we do submit data to the government as to who are the people with the names, addresses, and birth dates, and the phone numbers. Those people are vaccinated. How elaborate that system is and how are the analytics, how easily accessible that data, I have no clue. But if it was done, so to answer your question, the Centric Health has vaccinated 10,000 and Heart Hospital has vaccinated roughly 10,000 people. So between the two of my sister organizations, we have vaccinated 20,000 people. That's almost 20% of the people vaccinated.
Wow.
It's close to that in our part of the world. But yes, and I have always argued, I think with at least in my mind, with the substance, that the best place to deliver the shots is the doctor's offices.
Yeah.
And that would have been much easier to tabulate the numbers, who's vaccinated, who's not, and also to sell it to the people. People listen to the physicians because every time a person who has vaccine hesitancy and they have all those questions about what they read on Facebook and other things and how the vaccine was rushed, I patiently walk them through the process of development of vaccine, how long it has been. It's taken 30 years to bring the messenger RNA to convert it into a vaccine with all the brilliant minds in the field of genetics to make it happen. So when you walk them through and you tell them, I'm on your side, we are team together. I'm not going to sell you a governmental product. I'm not in that business. I make no money doing it. What I make money is by being a good member of the society and making sure you stay healthy. And that argument sells. I have no idea why they had to create all these symbolic large structures, Dodger Stadium and others, basically to confuse people.
Right.
I think there's still room left for the vaccine hesitancy to be overcome. The final pathway has to be the doctor's office.
I got it. I think that makes it where you have a relationship, you have some degree of trust because in your primary care physician, you're probably more likely to take his or her advice as opposed to whatever you read on the internet. Is that what you're saying? Yeah.
Exactly.
Yeah.
Right.
Right. Can you talk to me a little bit, Dr. Bombi, about these vaccine passports? I know there's a lot of resistance to that. You get into people who see it as a government overreach. What would that look like, and how would they work?
So the vaccine passports are, this is a concept which is mostly in concept phase. For a vaccine passport to be a significant identification product, it has to be, it should not be easy to fake it. Because right now what you get is a simple piece of paper that you got two vaccines. How difficult is that to fake? Yeah. So the authenticity of that paperwork is so superficial that it's irrelevant. The proof of vaccination is really down to honor system, because you can take the paper you have from our organization, you can easily duplicate it any number of times you want.
Yeah.
So the concept of passports has never been vetted or given a considerable thought. It's down to honor system. Also, look at the schism. The schism is the two kinds of people in this country or anywhere else. The people who are risk averse, who want the vaccine, and even after vaccination they are careful. And the people who are risk tolerant for a variety of reasons, who won't get the vaccine, won't use the mitigation measures, and will still intermingle. So that schism is what's going to drive the last 50% of the vaccination hurdle and the eventual goal of community immunity or herd immunity.
That's so true. And finally, Doctor, the CDC has opened up the Pfizer vaccine for kids 12 to 15. You in agreement with that? Have from what we know now, at least from I haven't heard anything but positive things in terms of how kids are receiving, how they're dealing with the vaccine?
There are two components to that, Richard. One is children vulnerability. Fortunately, this virus has been kinder to the younger people. So children are less vulnerable. Even then, we have roughly 300 kids who have died in this country, a small number relative to the larger adult population, but every kid is extremely important. And in this equation, the number one concern is parents. Parents don't want to assume even a minor or small amount of incremental risk to their children, and that's totally understandable. So, yes, the vaccination of children will emancipate kids and parents from the fear of infection, and that's huge. that will also open up the pathway to open up the schools in a comfortable manner. To lift the fear, it's necessary to vaccinate the kids. The strength of the vaccine is no different in kids as opposed to compared with the adults. So it's a necessary step. Whether we mandate for all the kids is another thing. Even right now, because vaccine is still considered emergency use authorization, even the military hasn't mandated it. It's still voluntary in the military. So for mandate to occur at every level, it has to be beyond emergency use authorization.
I didn't know it was voluntary in the military. Do you agree with that?
Because it's if FDA said it's approved, then it's easy to mandate. When it's emergency use, it's hard to mandate.
Oh, got it. So crazy. Okay. And finally, the Biden administration had invoked some rules on patent relaxation for these vaccines. Can you tell me what that means?
As we discussed on multiple occasions, that development of these vaccines is the crowning glory of science. The trouble with the production of the vaccine is it's a very complex, intricate science, and production the vaccines can be adversely impacted if the meticulousness is not maintained. You will remember that Johnson & Johnson had to waste millions of dosages because one of their subsidiaries called Emergent Biosolutions was at flaw in making the vaccine, so they had to waste. When you waiver the intellectual property rights and allow, for instance, Moderna or Pfizer vaccine to be made in a country A, B, or C, they won't have the scientific soundness. They won't have the manpower that is trained to develop those vaccines. What that does is, if there are any flaws in vaccine development, that will further hurt the vaccination sentiment. So, in my opinion, the best way is not to waiver the IP rights and intellectual property rights. The best way is to ramp up, scale up the production through the existing companies, because one of the bottlenecks, Richard, isn't the scalability in itself, but the raw materials. The raw materials, like making the little fat droplets to encase the messenger RNA in, is difficult to get. So there are many bottlenecks that will exist even if you have vaccine development in South Africa or India or other places. So the best is to ramp up the capacity through the existing companies and negotiate a price that's acceptable to the people in poor countries, and even give it for free, because as I suggested before, the vaccine diplomacy is the best way to generate the goodwill. People who are alive will remember that it came from America.
Oh, that's so true. That is so true, Dr. Bridgebomby. Okay, we're out of time, sir. Thank you, sir. I appreciate it. Always informative. I hope you have a good weekend. We'll be talking to you next week, sir.
Richard, stay safe.
Thank you. You too. Thank you.